Welcome to the Community Health Needs Assessment of Holland Township, New Jersey. Holland Township sits in the northwestern corner of the county of Hunterdon County. It originated in a municipality in 1879 and averages 23.9 square miles. There are two distinct river boundaries of the Delaware River and the Muscatong River. Holland Township has a community profile with a population of over 5,000 people. Females make a larger percentage of this population with 50.6% and males 49.4%. The median age averages 48.9 years. It is a large white non-Hispanic population with other ethnicities including Hispanic, Black, American Indian and Alaska Native, Asian, and people of two or more races. There is a large percentage of high school graduates and a moderate percentage of those with higher education degrees. People of all ages are within the county, from under 5 to over 65. Some of the township members are recipients of health care and social assistance. Others struggle with disabilities, and some are without health insurance. Holland Township has a median household income of $88,000 or more. Their median value of home is $354,000. Residents below the poverty level equate to 2.8%. Air quality is standard with a 7-day unhealthy breathing capacity in the year 2016. Well water shows higher levels than average in arsenic, iron, manganese, and E. coli. The Holland Township Community Profile overall reports safe, good school systems, and community involvement. Community organizations and groups, public and private business services, medical veterinarian services, waste, recycling management, and security of police, fire, and rescue form the community. Occupations of agriculture and farming, small business, professionals, laborers, and clergy. Holland Township residents can expect a 32.9-minute commuter drive time. The medical centers closest to Holland residents are within a 22-minute drive to the Hunterdon Medical Center or a 27-minute drive to St. Luke's Warren campus. Flemington, the hub of Hunterdon County, has shops and restaurants. This may take a 24-minute drive. In the township, we look at the 10 essential public health services. We look at assessment, policy development, assurance, and system management. Through using the public health model, mobilizing for action through planning and partnership, MAP will help us to evolve our plan for community health assessment. We can look at the demographics of Holland Township residents and the community geographic location and its transportation. We can assess the public transportation, the cost measurements, and the route discovery. We can look at the social groups, the local businesses, the schools, and the church organizations. And we can review who we partner with in the Hunterdon Medical Center, the Hunterdon Healthcare Partners, and the Holland Township private and government offices. We can use all this to vision utilizing transportation access. Community health systems we need to improve our quality of life and protect from potential barriers. Our goal in increasing public transportation is to evaluate, implement, and plan for the success of transportation among the township residents. Why is this important? Because in Holland Township, 16% of its total population is age 65 and over. This is greater than comparing the two neighboring townships of Union and Raritan. With an average drive time of 32 more minutes, Holland Township residents have a longer commute, even than the national average. How does this affect our seniors? How does this affect our people? In a small group discussion, the majority of people drive an individual personal automobile. Some of them walk or ride bicycles. Others use a taxi or an Uber. But none had used the transportation of the LINK system, which is the public transportation hosted by Hunterdon County. In our small group discussion, we see that at least 50% of the people questioned have used a friend or a relative for a ride and transportation assistance. So with this as our basic transportation, calling on friends or relatives, what's a senior to do? How are they to get out and about, not become isolated, to maintain their socialization, to get to their appointments? We can look at evaluating this health issue by using the 5-point criteria. We look at the social justice principles. Who can ride on this public transportation? Is it accessible? Is it even fair that this community has a public transportation? And we look at our priority population gaps. What group is at risk the highest? Our senior residents age 65 and over. We don't want them to be isolated. We don't want them to miss their doctor's appointments. We don't want them to not be able to get to the grocery store if they are unable to drive themselves. Is this condition prevalent in our community? Well, in the county, 40% of the population have unmet transportation needs. And how can we help protect any potential prevention and early intervention? We can include our leadership discussion, reevaluate our routes, and reevaluate our marketing of services. Would it be cost effective? Well, in a proposed plan, when we engage our leadership, engage our community, and review financial analysis, then we would be able to answer that question. So our plan of action to help the residents of Holland Township and to make sure our seniors can have the transportation accessible to them in an easier way, we want to look at a plan of action in collaborating, increasing our group discussions, looking at our cost analysis, and the marketing of our services. When we collaborate, we can look at our transportation team, our county and township leaders, and our community members. When we look at our focus group, we can increase the number of our participants and increase their diversity. Our cost analysis, we can review our routes and review the cost for staff increases. And marketing of our services, we can increase the use of marketing to make sure our seniors and our community members understand that this is a transportation available to them. We don't want our seniors to go isolated. We don't want our seniors to go without the assistance that they could possibly use. With a growing number of our residents reaching in that category, this is something that Holland Township should and look at for future improvement.